In this video, I'll give you the simple, effective trigger point therapy for your tennis elbow. Now, as a bit of background, as long as you get tennis elbow within a reasonable time frame, it should be very easy to get rid of. Now, what happens though is a lot of tennis elbow treatment is very poor, so instead it tends to get worse. Now, I'll link details of why, but basically tennis elbow is caused by two things combining to cause abnormal stress at the outside of your elbow where the muscles join in. And over time, that abnormal stress causes it to become sore, inflamed, and eventually damaged. Now, the first cause of abnormal stress is overuse. Every medical textbook mentions this. Now, what they don't mention though is that lumps in your muscles called trigger points cause the muscles to be abnormally tight and constantly pull on the attachment. Now, because doctors aren't told that, they'll tell you to rest thinking that it's going to stop the stress at your elbow and allow it to heal. But with the abnormal tightness pulling on your elbow all the time, of course it won't. Now, what happens then is therapists will still ignore the abnormal tightness and focus on the inflamed, injured part. Now, they'll rub it, zap it with laser, or stick it with needles to try and get it to heal. Now, of course, that doesn't work, so then they recommend stretches and exercises that further stretch the attachment. Now, eventually there's so much damage in scar tissue that surgeons get a piece of action. Now, my aim for this video is to show you how to find and fix the problem so the tension will come off your elbow, letting it heal and helping you avoid getting caught up in what I've just described. Now, what I'll first do is show you some simple tests you can do yourself just to make sure it is tennis elbow and you do have the trigger points causing abnormal tension. Then I'll show you two simple trigger point therapies to take care of it. A standard disclaimer, this is not specific advice, just general information to discuss with your own healthcare professional. Now, to make it all easy to follow, let's look at this diagram so you can see the anatomy. Now, you can see the muscles in the back of your forearm. Now, they're the ones that get the lumps and tighten, and you can see where they attach and pull on the outside of your elbow. Now, the first thing you need to do is to make sure you do have tennis elbow. Now, we start with two basic tests that stress where the muscles attach. Now, if you have tennis elbows, these will hurt. Now, first, bend your wrist backward like this and push it up to tension the muscles. Next, you bend it forward like this to stretch the muscles. Then we examine where the muscles attach to make sure that there is a sore spot. Now, use the tips of one or two fingers to examine the outside of your elbow and you should find a very tender spot. Now, once we're sure it's tennis elbow, we check to see if the forearm muscles are tight and lumpy. Now, these muscles are on the back of your arm and run from the wrist side of the sore spot right through to nearly to your wrist. Now, start with the flats of your fingers and do a general examination looking for general tightness and tenderness. Now, if you find anything suspicious, use the tips of one or two fingers to examine more deeply, looking for tightness and tender lumps that hurt when you press on them. Now, once you've found those, I'll show you a very simple test that will confirm that these lumps are causing abnormal tension, stopping your elbow from healing. Now, what you do is do the tests I've just shown you, then do one of the treatments I'll show you next, and then redo the tests. Now, if the tests are improved, that's 100% positive that the tension from the lumps is affecting your elbow. Now, I'll do a quick demonstration how this works. Now, you do the tennis elbow test first. So, ouch, that's sore, ouch, that's sore, ouch, that's sore. Now, next you do one of the two treatments I'll show you. Then repeat the test if the things have improved. So, that's better, that's less tender. Now, the key is that we've done nothing to the elbow, so if it feels better, it's because it's much happier after the abnormal tension is removed. Now, with that, let's show you the two treatment options. Now, the first trigger point therapy I'll show you is very easy and there's no special equipment. It's a combination of massage and trigger point therapy. Now, first I'll get some oil to lubricate over the skin. Now, it doesn't need to be special oil, just as long as it's slippery. Next, use just light to medium pressure with your thumb. Start down near your wrist and slowly move towards your elbow, stopping just short of the sore spot. Now, I don't want you to touch the sore spot. Now, when you do this, pretend to squeezing gunk out of an old sponge. Now, when you get to a tender lump, stop and maintain the same pressure for about 10 seconds, then keep going. Now, you'll need several sweeps to do all the muscles, then you can repeat a couple of times, gradually increasing the pressure. Now, hopefully you feel a lot better, but the trigger points are very stubborn, so you'll never get rid of them with one or two applications of trigger point therapy. Now, what I do is repeat this every day, keep going till you can no longer feel any lumps in your muscles, then give them a once over, say once a month, to make sure they stay nice and healthy. Now, the other technique is faster and easier, but you need a vibration massager. Now, I'll link full instructions and precautions, but simply you find each of the tender lumps, then sit the massager on top for about 30 seconds. Now, I'd normally be doing this over cloth or a shirt sleeve, but I'm doing this like this so you can see what I'm doing. Now, the same advice I gave for handheld trigger point therapy applies. Don't touch the tender spot outside your elbow and keep at it until all lumps are gone. Also, trigger point therapy should be the main thing to help your elbow, but there can be a bit more to do, so I'll link an article with the full how to treat tennis elbows at home. Now, if you're just doing trigger point therapy to your forearms, the simple trigger point technique I showed you will be fine. But if you have other issues as well, you're far better off getting one of these. Now, the self-trigger point techniques I showed you are much harder to do on larger muscles and impossible where you can't easily reach. Now, people try to massage them with foam rollers, but as I discussed in a linked video, they're not very effective and you can easily hurt yourself. But if you have something like this with a proper handle, you can easily reach and apply effective trigger point therapy anywhere in your body. Now, that says you need a proper therapeutic vibration massage, not a massage gun. Now, a massage gun won't give you anywhere near the quality therapeutic vibrations. It'll be more likely to hurt you. Now, I'll link how to tell the difference, but I don't want you to get hurt, so I'll quickly show you the difference. Now, the machine on the left is a genuine vibration massager. Now, you see it has a contact pad that sends in large amounts of vibration. Now, the tool on the right is a T-bar, which massage therapists use to apply deep, painful pressure. Massage guns are basically T-bars with jackhammer mechanisms to help drive the head in. And straight away you can see that the massage gun delivers a lot less of the therapeutic vibrations you'll need to dissolve the trigger points. Massage gun marketers claim that driving the head in increases penetration, but it's the vibrations that have the benefits, and as you'll feel, they go right through you. Now, driving the head in only potentially hurts you. Now, check out the video I'll link, but you'll find that genuine vibration massages are not that common, and most are designed for professionals like myself to use on patients rather than for self-use. Now, I'll picture a couple of examples here. Now, because of that, we build our own personal use vibration massages. Now, this is our general purpose massager. Now, the business end delivers copious amount of therapeutic vibrations. It's got a proper ergonomic design handle so you can use anywhere in your body, and has very easy to use controls. The on and off switch is underneath and has a sliding variable speed under your thumb. Now, over the years, we've sold over 100,000 of these without any advertising, mainly through professionals like chiropractors, osteopaths and physiotherapists using them and recommending them to their patients. Now, more recently, we've developed our quad head machine that has all the good things of a general purpose massager, but can do a much greater at once. Now, because the front part is larger and flatter, you can also easily use it like a chair or cushion massager. Now, for more information on using vibration massagers around machines or tennis elbow, please see our website or the description. If you have any questions or comments, please don't hesitate, and thank you very much for watching. It has been most appreciated.